Hi, it's Dr. A from Intentional Self Aesthetics. So today I wanted to talk a little bit about the difference between prescription tretinoin and medical grade retinols. And so I'm going to go through a few frequently asked questions, and maybe some of these have been raised in your mind. So first, what is the difference between prescription strength tretinoin and a medical grade retinol? Well, by definition, tretinoin is prescription strength, meaning that you need a prescription from a physician for that. Usually a dermatologist will prescribe tretinoin. It's a retinoid. It works pretty fast, it's strong, and it does the job, but it's usually very harsh on the skin. Medical grade retinol, though, is a professionally formulated retinol. It does work. It is effective, but is less irritating for your skin. Then the next question follows, obviously, which works better, tretinoin or retinol? Well, tretinoin will work quickly, but it can be less well tolerated. So it's more harsh on the skin. People don't use it consistently, so it may work, but it's not something that you can use on a long-term basis. Retinol, on the other hand, that's a medical grade retinol, is more gradual, but it's effective, but it's more stabilized, and it has more supportive ingredients, and it is more effective long-term because whoever's using it is usually probably using it more consistently because it's much more gentle. So why do people struggle with tretinoin? And it's because there's side effects to tretinoins. The side effects include redness, flaking, dryness of the skin. It's hard to stay consistent with these side effects, and so if you're not consistent, you won't see results. Another question we see is, how are medical grade retinols different from over-the-counter retinols? So something maybe you'd buy in a drugstore. Well, medical grade retinols, such as what you would buy in a place that sells medical grade skincare, such as Intentional Self Aesthetics, sell medical grade retinols that are stronger, they're more stable, and they're also more clinically tested to penetrate the skin effectively. Over-the-counter versions are less effective because they are less stable, they don't penetrate the deeper layers of the skin, and they don't really last in their potency. So that's why it's more recommended that you use a medical grade retinol. So really wasting your money on over-the-counter versions is really not recommended. So who should actually be using tretinoins? Folks that use tretinoins usually are under the supervision of a dermatologist. You should be under the close supervision of a dermatologist, especially since there are side effects that can be significant, and or if you have severe acne. Most people can get away with using a high quality medical grade retinol, but which is also better for anti-aging and for skin health overall. So why should you come to us at Intentional Self Aesthetics for your medical grade retinols? Well, in a word, really, because the medical grade retinols that we have here are actually enriched with hydrating and soothing ingredients that are going to maintain your skin barrier, and those you can use consistently. We will give you instructions on how to use them, and usually our clients have a really good experience with them. They're usually sold in in different concentrations. We'll start with a low concentration first, and then you can increase from there. But we help you go, you get stronger as time progresses. So we really help you through it. And what kind of results can you expect from using a medical grade retinol? Well, what you can expect is you can expect a really good payoff from using consistently a medical grade retinol. You can expect brighter, smoother skin. You can expect smoother, reduced fine lines, and a more even complexion. And it's a really great way to keep up your anti-aging skin routine at home by using a medical grade retinol. It's easy to use consistently if you use the right product that's going to make you hydrated and preserve your skin barrier while keeping your skin bright and smooth. So that's really the distilled version of the Tret versus Ret argument. And if you have any other questions, just book a consultation with us at Intentional Self Aesthetics. Thanks.